Hello students, today we will study about complete denture prosthodontics. This is the introductory part of the complete denture. The contents involve definition, functions of complete denture, component parts of a complete denture. Definition: complete denture prosthodontics or full denture prosthetics is defined as the replacement of the natural teeth in the arch and their associated parts by artificial substitutes. It can also be defined as the art and science of the restoration of an edentulous mouth. Next, complete denture is defined as a dental prosthesis which replaces the entire dentition and the associated structures of the maxilla and mandible. In short, it wants to describe that complete denture is the prosthesis which is given to the patient for the full mouth rehab as the aesthetic mastication purposes. Classification: removable complete denture and fixed complete dentures. Generally, complete dentures are fabricated for geriatric patients, some young patients who are born with congenitally malformed teeth or edentulous arcs require complete dentures. It is essential for a dentist to evaluate the patient before treatment. This section discusses in detail the steps involved in the fabrication of a complete denture and the various modifications done to suit the needs of the patient. This chapter will cover the contents of the entire section in a brief manner to give clear idea about the prosthesis. Now, functions of a complete denture. Complete denture functions to restore aesthetics, mastication and speech. Aesthetics: the complete denture should restore the lost facial contours, vertical dimension. Second, artifacts like stains can be incorporated in order to improve the aesthetics. Next, mastication. A complete denture should have proper balanced occlusion in order to enhance the stability of the denture. Third, phonetics. Phonetics means speech. One of the most important functions of a denture is to restore the speech of the patient. The next parts of complete denture. It is important to have a thorough knowledge about the various parts of a complete denture before we discuss about the various procedures. A denture has 3 surface and 4 component parts. Surface of a complete denture. The 3 surfaces involved in the complete denture are impression surface, which is also known as intaglio surface, polished surface, cameo surface. Polished surface is also known as cameo surface, and the third is occlusal surface. First, impression surface or intaglio surface. It is defined as that portion of the denture surface which has its contour determined by the impression. This surface refers to the surface of the denture that will be in contact with the tissues, that is the basal seat area and limiting structures. When the denture is seated in the mouth, this surface is an active replica of the tissue surface of the patient. It should be free of voids and nodules to avoid injury to the tissue. In short, it has said that impression surface is the surface which touches the mucosa of the patient's mouth. Polished surface. Second, which is also known as cameo surface, it is defined as that portion of a surface of a denture which extends in an occlusal direction from the border of the denture and includes the palatal surface. It is the part of the denture base which is usually polished and it includes the buccal and lingual surfaces of the teeth. This surface refers to the external surface of the lingual, buccal, labial phalanges and the external palatal surface of the denture. This surface should be well polished and smooth to avoid collection of food. So the polished surface is the surface involving the buccal, labial, lingual phalanges. The phalanges we will read in the next some of the slides. Then you will know about it more clearly. Occlusal surface. It is defined as that portion of the surface of a denture or dentition which makes contact or near contact with the corresponding surface of the opposing denture or dentition. This surface refers to the occlusal surface of the denture teeth. It resembles the natural teeth and usually contains cusps and sluice ways to aid investigation. In short, the occlusal surface involves the occlusal contacts of the teeth, occlusal contacts of the artificial teeth. Parts of a complete denture. Initially, we have learned the surfaces, the three surfaces involving impression surface, intaglio surface, polished surface, cameo surface, and occlusal surface. Now, parts of complete denture. Denture base, second denture flange, third denture border, fourth denture teeth. Each of these parts have been explained in detail here. Parts of a complete denture. Denture base. It is defined as that part of a denture which rests on the oral mucosa and to which teeth are attached. It is usually made in acrylic resin. In some cases, metal denture bases are prepared. The denture bases form the foundation of the denture. It helps to distribute and transmit all the forces acting on the denture teeth to the basal tissues. It has the maximum influence on the health of the oral tissues. It is the part of the denture which is responsible for retention and support. Denture base. Denture base can be acrylic resin denture base. It is the most commonly used denture base material. It is easy to fabricate and economical. It is supplied as a powder, polymer, and a liquid as a monomer. Now, denture base of acrylic resin has certain advantages and disadvantages. Advantages involve acrylic has a translucent pink color which closely resembles the gingiva, providing good aesthetics. Second, these dentures can be easily rebased, relined as required in the future. Reline and rebase means to make the old denture more fit and more efficient for the patient. The terms relined and rebase will be discussed in another topics to make it more clear. It is also available in third. It is also available in various pigmented colors, which can be used for characterization. Next, the material is quite strong and can withstand normal occlusal forces. These are the advantages. The disadvantages: it cannot be used in thin sections like a metal denture base. Hence, it affects the speech of the patient. Next, it does not transmit any heat, so that the patient perception of temperature of the food is decreased. Difficult to maintain. Now, metal denture bases can be fabricated using gold alloys, chromium, cobalt, or nickel chromium alloys. Metal denture bases has also certain advantages and disadvantages. Advantages involving mandibular dentures are heavier, so the retention and stability is improved. Improved thermoconductivity gives good sensory interpretation. They are strong even in thin sections. Thin sections are very comfortable for the patients. And the last, it is easier to maintain. Next disadvantage is more expensive. It is more expensive, requires more time for fabrication, require refractory cast material, difficult to fabricate, cannot be replaced. Parts of complete denture. Flanges of a denture. Flange. It is defined as the essentially vertical extension from the body of the denture into one of the vestibules of the oral cavity, also on the mandibular denture. The essentially vertical extensions along the lingual sides of the alveolingual sulcus. In short, the flanges are the extensions which uh, which are placed into the vestibules of the patient. These are vertical extensions of the body of the patient which rest on the vestibule of the oral cavity. It has two surfaces, namely the internal basal sheath surface and the external labial and lingual surface. The function of the flange include providing peripheral seal and horizontal stability to the denture. The flanges are named based on the vestibule they extend into. As labial flange, it is defined as the portion of the flange of denture which occupies the labial vestibule of the mouth. Thickness of this flange provides aesthetic lip support. It has a V-shaped notch to accommodate the labial frenum. The labial part means the front part behind the lips and anterior to the incisors, the vestibular area. The labial vestibular area where the labial flange rests, and it has a V-shaped notch to accommodate the labial frenum present on the labial side. This labial frenum provides more retention to the denture. Flange. Buccal flange. It is defined as the portion of a flange of a denture which occupies the buccal vestibule of the mouth. It provides the required cheek fullness in aged edentulous patients. In the mandibular denture, it also transmits the occlusal forces to the buccal shelf area. The buccal frenum is attached to active muscle fibers, hence, additional relief should be provided in buccal flange. Lingual flange, the portion of the flange of mandibular denture which occupies the space adjacent to the tongue. As lingual flange rests in the alveolingual sulcus, it should be in contact with the floor of the mouth to provide peripheral seal. However, overextended lingual flanges can lead to loss of retention due to displacement during the activation of the muscles of the floor of mouth or while doing the movements of the tongue. Parts of complete denture. Now, parts of complete denture involves next denture border. It is defined as the margin of the denture base at the junction of polysurface and the impression surface. The polysurface other name was cameo and the impression surface other name was intaglio. It is responsible for peripheral seal. The denture border should be devoid of sharp edges and nodules to avoid soft tissue injury. Overextended denture borders can cause hyperplastic tissue changes like epulis fistulatum. On the other hand, the border should not be underextended as peripheral seal may be lost. Parts of complete denture. Now next is denture teeth. It is the most important part of the complete denture from the patient's point of view. The functions of the denture teeth are aesthetics, mastication and speech. They are usually made of acrylic resin or porcelain. There are different types of denture teeth which are classified as based on the material acrylic and porcelain teeth. Interpenetrating polymer network resin teeth, which is also known as IPN resin. Gold occlusals acrylic resins with amalgam stops. And next, based on the morphology of teeth, anatomic, semi-anatomic, non-anatomic or zero or cuspless teeth, crossbite teeth, metal insert teeth. This is the classification based on the material and based on the morphology of the teeth. Now final steps in the fabrication of a complete denture. Now it is as differentiated into the clinical procedure and the lab procedure. First, clinical procedure involves diagnosis and treatment planning of the patient. In diagnosis and treatment planning involving the checkup of the patient and looking the oral cavity, examining the oral cavity and the past and medical and dental history of the patients. Then next is treatment plan. After making the complete treatment plan, choosing the type of prosthesis to be given to patient, the design and the material, and applying the design considerations. It means that according to our consider of the health of the patient or the shape and the consideration of the oral cavity, what design should be given to the patient. Next, pre-prosthetic surgery if required, like excision of tori, frenectomy, alveoloplasty, vestibuloplasty, ridge augmentation procedures, and removal of undercuts if required. These terms may not be too understandable. It may be by doing the next lectures or understanding the topics when it will come and we will discuss. In short, tori is a bony part on the oral cavity which should be excised for the fabrication of the complete denture to make the prosthesis. Frenectomic means the removal of the frenum. Alveoloplasty means the shaping the bone. Vestibuloplasty means shaping the vestibular area. Ridge augmentation means shaping the ridge of the patient, reducing and removal of undercuts. Next, the clinical procedure involves the making the primary impression using impression compound or any other material of choice and refining the impression. Now, after taking the primary impression, we will go to the lab procedure as we will pour the diagnostic cast using dental plaster. Dental plaster means POP. Mostly we prepare diagnostic cast by POP. Now after that we will survey the diagnostic cast using a surveyor. We will discuss about surveyor in next upcoming lectures. Surveyor is a instrument which is used to survey the cast as we place on it for any undercuts, defects or examining, identifying the presence of undercut, measuring the depth of the undercut. Next is the pouring the master cast. As we have taken the next is making the secondary impression. After doing primary impression, pouring the diagnostic cast, then we take a secondary impression, then we make the diagnostic impression with the alginate and pouring the primary cast with dental plaster, surveying the primary cast to determine the path of insertion and adapting a spacer and fabricating the special tray over the primary cast. Fabricating the temporary denture using shellac or acrylic. Temporary denture base. After making a spacer, we will make a temporary denture base as to and making relief areas. Then a temporary denture base is made. Then we will make the secondary impression using zinc oxide original impression paste. Pouring the master cast using dental stone. Fabricating occlusal rims using modeling wax. Recording the PPS area posterior palatal seal. Trimming the excess green stick compound. Scraping out the wax in the special tray. Providing relief folds over the area where additional relief is required. After that, we will record the tentative jaw relation of the patient. Then face bow transfer and articulation. Anterior teeth arrangement, anterior try-in, posterior teeth arrangement in balanced occlusion, try-in verification, wax up, processing the denture, finishing the denture. Check for proper fit and function, give proper instructions, refine occlusal discrepancies if any, recall after 24 hours to check immediate changes, call for a review after a week, recall every 3 to 6 months for review. These are the order steps, step-wise orders which are performed in the clinic and in lab. The steps go hand in hand with clinic and lab procedures. Thank you so much. This reference is taken from the Nalaswamy book. Tata, bye bye. Enjoy your day.